So World Health Organization has predicted that there will be a dramatic increase in the cases of head and neck cancer by the year 2030. And importantly, the survival rate remains almost constant over the last half century. And we need to know why this is the case and do something about it. Most patients turn up late with advanced tumor, requiring major operation. And it's very expensive, debilitating, and requires 10 days hospitalization at the minimum, poor morbidity, and low survival rate. If we can detect it early, it's a simple surgery requiring no more than 20 minutes. It's a local anesthesia, low cost, no hospitalization, no morbidity, and a very high survival rate. The problem is in pre-cancer detection. 90% of oral lesions are benign, and only small percentage, 10%, progress. There's no method that at the moment can identify these 10% of high-risk patients. Because cancer is a genetic disease, we do need a genetic tool to tackle this problem. So our solution is to have a genetic test. So at the moment, patients with unknown oral lesions are put on watchful waiting. And this is a fantastic recipe for causing anxiety, stress, wasting time, burden on the NHS. Our solution is to take a little bit of biopsy, extract genes, and measure the genetic changes and convert it into a measurable cancer risk so that we can identify these 10% of patients and treat them quickly, release the 90% of them without high risk, and reduce the anxiety, and hopefully we save time, money, and lives. The genetic test is currently in progress. We have published our first clinical study involving samples from donated by patients, and this is the world's first head and neck cancer test, and there's no other organization similar to ours that has the capacity to do this. In summary, we aim to create non-invasive screening together with the early diagnostic tests in order to reduce uncertainty in patients and provide a better and faster treatment and overall improve patient outcome. I'd like to thank Saving Faces and the Wellcome Trust for funding this research. And we do need the NFORC data sets in order for us to trace patients' outcome and which will benefit.
This is absolutely brilliant, creating the world's first ever research centre dedicated to this most socially sensitive part of our body, which will collect major data and organise research to improve patient treatment worldwide. Well done, Saving Faces.